I'm Dr. Mohana Vamsy, Chief Surgical Oncologist at Omega Hospitals, Hyderabad. As we are aware, we are celebrating Breast Cancer Awareness Month in October. If I discuss more about breast cancer, more people would be aware of early warning signals of breast cancer so that we can diagnose breast cancer early. What is important is diagnosing breast cancer early. If we could diagnose breast cancer early, we would be able to cure the breast cancer without even sacrificing the breast. That is, just by doing lumpectomy and whatever auxiliary procedure necessary, we would be able to cure breast cancer. So the key is diagnosing the breast cancer early. For this, all women in India must be aware of early warning signals of breast cancer and screening for breast cancer. The most important warning signals of breast cancer are lump in the breast, skin thickening over the breast, change in the shape and size and contour of the breast, any small nipple discharge, bloody nipple discharge, any lump in the armpit. These are all the early warning signals of breast cancer. If any woman notices any of these symptoms, without neglecting, she must visit her nearest family physician, a lady doctor or a general surgeon, so that the practicing clinician could identify, diagnose breast cancer and stage the disease and treat the breast cancer early. One must also be aware of risk factors for breast cancer. Those women who do not have children, those women who have children, had their first child at a very late age, those women with family history of breast cancer are at an increased risk of breast cancer. Also, obese women, those women who smoke and who take alcohol are also at an increased risk of developing breast cancer. So all these groups of women must undergo regular breast cancer screening. Screening for breast cancer has three arms. One is the most important one is self-examination. If you could comfortably perform self-examination of the breast every month, preferably a week after their periods, because breasts are most supple during that time, examining the right breast with the left hand, preferably with the flat of the hand, and the left breast with the right hand, systematically starting from the center to the periphery, you would be able to identify lumps, or you will be able to identify subtle changes which happen in the breast and bring it to the notice of the clinician. At the end of the examination, one must lie down on a bed and put a small pillow under the shoulder blade and then continue the examination same way as we had done before, so that any changes in the breast can be identified very easily and can be brought to the notice of their family physician. The second arm is examination by a trained personnel, like a trained nurse or a clinician or their gynecologist. Every year they must examine them. They must get themselves examined by a trained personnel and also learn how to examine at the same time. Third and most important arm is mammography. With the advent of digital mammography, amount of radiation delivered to the breast is very low. So women should undergo, preferably every year after they are 50 until they are 65, annual digital mammography. With annual digital mammography, you would be able to identify even smaller lumps. The baseline mammogram should be obtained at the age of 30, second one at 35, third one at 40, after 40 once in 2 years, and after 50 once in a year. Those women with increased risk factors should have annual mammography starting from the age of 40 itself.